Hello, everyone. Welcome to another edition of Clock Talk with Dr. Greg Brannon. How are you today?
Fantastic, Jim.
As always, 15 minutes, if I can get this thing started, full of information. Today, we're continuing our series on testosterone for different age groups, both male and female. I'd like to talk today about the 31 to 45 dynamic, because now you got people that are having babies. They're running around playing chauffeur to their kids, a lot of energy. They might be working full-time jobs while they're taking care of their kids. Like, life is totally different.
Yes, it is.
For a lot once they hit that 30 to 45 age group. So, as always, this time we'll flip it around. Let's go with the female first today. So, the difference between this age group, 31 to 45 female, compared to the 20 to 30-year-old female.
In one respect, it's still a very healthy reproductive window part. And we know by studies that women are pushing babies out a little bit. This is fine. I mean, a lot of, there's actually studies show the older you have a baby, the longer you might live. There's actually some studies on that. But the further the range, the window decreases, called fundability. In your 20s, is roughly pregnant about 20% per month. Around 35 is around 15% per month. It falls off around 40, 41. It has to do with probably the age of the egg. Because don't forget, these eggs are inside that female when they're inside their mommy. Okay, so a baby that's in the womb about 20 weeks old has around 20 million eggs. At birth has about 7 million eggs. And then every month when puberty hits, about 4 month battle it out. And so in your lifetime, you probably release around 100,000 eggs because it's 4 per month. So the longer they sit there, they're in a, we were biology guys, mitosis and meiosis. Meiosis is how sex cells divide. So they're stuck in a stage of that time. So that might be part of the problem, but they don't, this shucks. But the bottom line, their life has changed. So now we're going to say their reproductive ages, they're done with their babies, but they're going. So do they want more babies? Do they want contraception? Do they not want contraception? It's very interesting though, Jim. We've looked for some studies now that how the birth control pill works. There's 2 of them. One's a combination pill, which is high synthetic estrogen and a synthetic progestin. And it tricks the body you're pregnant. So you do not ovulate. There's also a high progesterone only pill, because synthetic estrogen taken orally can increase blood clots. So if you have a blood clot disorder, you can't take it. But there's a risk of breast cancer. It depends what you read, but roughly about 25 to 30% risk. So they got to keep that in mind as well. But family planning is your personal decision. So in their life, what could happen this time? They're going to come to me at this. I have 2 kids. I'm always tired. I can't sleep. Even when I sleep, I'm not awake. I'm not alert. It must be this stage of my life. In my new book, Restore, my wife, we have 7 children. She says a little story about, we had at the time 5. And she said she's just tired because of all the kids. And a little joke, but after she got placed at pellet, she's like, "Well, why did you not know about this 15 years ago?" Because she felt alert again. But so the thing is, we got to listen. And this is what bothers me with women's health care. The standard of care for, I'll say PMS, the standard of care for anxiety, depression, hormonal issues, they go directly right to an antidepressant. And I'm not saying there's not a place for that, but not 75, 80% of it. We should look at the root cause like any other endocrine disorder. In low thyroid, we give thyroid. In diabetes, we give insulin. We should look at that the same exact way. And a woman knows their body so well because they know their cycle, they know their moods, they know that. We should listen to them. And I think that's part of the problem, Jim. We don't, here's your Band-Aid, move on. So I look at, to individualize it, that testosterone is still a drug. If you're cycling, you don't need estrogen because you're still making your own. But this may be a part as you get closer to the mid-40s where you're skipping cycles now and then, is where you might add progestin. Because when a woman's cycle starts, that's called menarche, the FSH part of the cycle matures first. The ovulated part matures second. Great. As you age, the LH part, the ovulation part, dismatures faster. That's why women start to skip cycles. So there's sometimes, what are the side effects of that? Skipping cycles, not sleeping, having tender breasts when they are cycling. So that's where progesterone bioidentical can actually come together. That's where that works.
So if you're on the birth control pill,
yes,
and let's say you have low testosterone.
Well, you are going to be, because the birth control pill is very interesting. It tells your body you're pregnant and you're a menopause at the same time. So your ovaries stop working. So you
Okay.
make, so when I get your labs, so if you didn't tell me you're on birth control, when I look at your labs, it will say FSH, an FSH over 23 is menopause. A real low FSH means you're pregnant. And I will look at that and there'll be no estrogen, meaning they're menopausal. This is a 32-year-old woman. Estrogen 0, FSH 0. That is, again, that's a menopausal pregnant woman. Can't occur. What's that doing to the body? What's that doing to the brain? A woman's built for those cycles. So it's like, no wonder you feel bad because you're having 0 testosterone, which is the hormone that makes you feel good. It's crazy. We just don't believe both. In America, it's not standard of care to, in fact, there's a patient today went to a gynecologist in town and said, you need testosterone, but I can't give it. Find Optimal Bio. Very interesting. It was very
It's a
nice.
good referral.
Very good referral. She had our book.
Yeah. So that the patient then goes on testosterone and she feels better. And is her endocrine system balanced better?
Well, if they're on the pill, we can make them feel better with the pill on board. Yes. The algorithm we have actually takes that into consideration. Optimally, we like to get the IUD and the birth control pill off. In fact, there's a lot of women out there talking about how they feel better off the pill. I think it's more natural to have your cycles. We were listening, you and I, a year or so ago, Dr. Uberman had who to have on the cycle? It was a Stanford trainer talking about her Olympic athletes do better when they ovulate.
Right.
Because you think about it, an athlete they became amenorrheic because they work out so hard. She finds, no. Actually, when they're in better hormonal balance, they're still having their periods. Same thing as you age with that. So ideally it'd be nice to have no hormones on top of that, but we can actually balance that, help improve their symptoms with it.
And in this age group too, you're seeing a little bit higher testosterone readings before we treat compared to the 20 and 30 age group?
I say one more generation up. Probably when we get to the 45-year-olds and over. I'll give you an example. My wife was 46 when she started. Her level was 7. My 20-year-old daughter was 0. And that's typical of what I have.
Wow.
And so very rarely do we have a 20, 25. I've heard people on podcasts say a woman should never be over 50, over 40. I'm like to myself, where do they get that data? Like I want to know where that data, like why do you put a limit on something when it's so individualized? And that's why it's important. There is an MRI study that called the Zeit-Berlin test that showed how you feel. And it actually is, you're going to get benefits at certain levels around 90, 70, and 90, you're going to get benefits. But how you feel is very individualized and how it works in your brain.
Seems to be there's concern out there with some of the patients in this group, but also in most groups that once you're on BHRT, your body stops making testosterone. And then if you ever decide to go off it, your body's basically frozen.
Yeah. For both men and women, the why you're coming because your testosterone is at a low value. So you're making some. It does decrease production. Not all of it, but it does decrease some. But if your level is 1/10 of what it should be, now your level is at 100% what it should be, you're gonna be coming back because you feel better. And besides that, we'll get in the other age group. But again, it helps decrease diabetes, cardiac events, dementia, Alzheimer's disease. All these are known, proven, osteoporosis are true benefits as you age. I think the big issue as we age is can we prevent or push out chronic diseases? I was born in 1960. Roughly 3% of Americans had a chronic disease. Now, as you know, it's about close to 65, 70%. So something's going out there. And I think to make this body more resilient to this environment is to keep your sugar optimized. We know sugar is poison. When I say that, the amount we're told to eat is not correct. We've been for 6,000 years of human history, it's fat and protein. That's what we eat with some sugar. But today, ultra processed food it's not natural stuff. So what's that doing to our endocrine system, doing to our natural brain development? As you know, Alzheimer's disease is called type 3 diabetes. It's not a different disease. It's type 3 diabetes. These sugar moieties stick. And we know that testosterone actually enhances the sensitivity of insulin, so therefore, i.e. lowers diabetes risks.
Let's flip over to the male.
Okay.
I'm just thinking from my past experiences, this is the group that has the kids with the wife. He's working, she's working, they're running around crazy. But he's also in a softball league or a soccer league on the weekends.
Yep.
And half these guys end up getting hurt.
Dad bod.
So from a testosterone perspective, let's walk through how that benefits the male.
Yeah, we're always told testosterone starts dropping as you age in the 40s and 50s. Andropause is man's menopause, men's menopause. It's now, we document it in the 30s, if not earlier, but it's going back again. Their start was such a much lower value than their great-grandfathers. If you start at 12, 1300 and you lose, and I'll go reason why you lose over time in a minute, or you start at 300, you have very low value there to protect. And again, we don't lose testosterone because we get older. It's longer we live, the more we're exposed to these toxins. A man should be able to produce sperm his whole life. It's the woman that has that window of time. So what's happening is we're starting at a lower value and we're losing at a faster rate. That's what, so men, same thing. Tired, brain fog, it's my job. I'm trying for promotion. That gets the dad bod, the belly happens. We say, well, when I was 18, I could do anything I want to do. Well, what did you do? You worked out. I got all that. But you had testosterone. Why does no 8-year-old boy have prostate cancer? Testosterone suppresses it. Just the opposite, we're told. So what's very important is to understand is that your body, your signs or symptoms are these red flags warning you what you need to do. And it comes down to, I don't want to make it a panacea of testosterone. Sleep is number one. Number one. So how can I make it that my testosterone go up naturally? Sleep. Lift heavy things with your legs. Eat a nice high protein fat diet. But there's only so much your testicles or ovaries can produce, and women's adrenals as well, because of how they're set in the womb. I can't stress that enough. And
then we think too with both female and male, having that higher testosterone level does increase bone health, muscle health.
Keep talking.
And therefore you got a better foundation, so to speak, as you continue to get older and older.
And the real thing, motivation. Motivation. I hear all the time, I've lost my drive. This is what makes a lion a lion. It's not, I'm a lion. I'm confident. I'm things like that. So I know I repeat this all the time, but it's the most abundant active hormone in the human body. Why are we working with 10 to 20% are our forefathers? Why do we accept that? We're normalizing disease. What we're doing, we're normalizing disease. And what I want to do is keep the body optimized so that our golden years are our whole lifespan, not just this little window of time. But the symptoms of, I'll say, low T are actually getting much earlier in age. And we know why.
Yeah. I also think too, with this age group, just from a practicality standpoint, BHRT, in our case, the pellet, is a much better application. You literally got to give up 15 minutes of your time.
Twice a year
or 3 times a year. Whereas if you're on those shots, the creams and everything else, you're doing those daily, weekly, et cetera, and you got this really busy lifestyle. Can you speak to that?
100%. First off, is the molecule being injected is different. That's important. The people that sell the esters, they say they're bioidentical. They're technically correct because after you cleave off the ester, the active molecule is bioidentical. Yes, but the ester is not. That's why the half-life runs between 1 to 3 days. That's not what the pellet does. The pellet releases at a steady state exactly the way a testicle does or an ovary does. And that is really important because testosterone, again, is the precursor to estradiol. And that enzyme called aromatase wants a steady release. That's why, so believe it or not, the roid rage of testosterone therapy, it's not testosterone. It's the fluctuation of the estrogen metabolites, not the testosterone. So the whole idea, Jim, is that we want to mimic exactly what our body makes it. There's nothing better than the pellet. The pellet mimics what an endocrine gland does. It secretes the hormone directly into the blood, and the cells that need it can grab it at a steady state.
And also, too, I think, again, this is the age group that has the newborns to the, 10 or 12, 14-year-olds. So you got that 2-year-old kid you got to pick up. And if you just rub cream all over your body, you have to wait for a while.
You got to wait for a while. It rubs off in 7 hours. But real quick, Jim, we could talk all we want, but we've probably placed, 150,000 placements over our career. We have a 97% retention rate. We've had nobody go back to shots or creams. If they have one or two, I don't know. But out of that kind of patient, so, and this is also important, everybody comes to us with so-called normal values with all these symptoms. We get them in 1940 values and the symptoms go away. That tells us what the scale they're using is incorrect. We must personalize the treatment and look at the individual. There's nothing more important. Well, in medicine, I think the most important thing is informed consent. That is the cornerstone. That's why education first is crucial. And then to handle any complications, which are a loss of pellet, and to be able to answer any questions scientifically. That's why we really pride ourselves on that.
And then in this age group too, how many percent-wise do we treat?
About 60% female, 40% male.
Okay. And then overall from all the age groups that we're treating, are they?
Now this group, this is about 45% of our, about 40% of our practice.
Okay.
Yeah.
Wow. You would think it'd be older, and it's really not.
It really is not. 37 to 42, 45 is our 40% of our patients.
Mm-hmm. As always, another great edition of Clock Talk with Dr. Greg Brannon.
Thank you, Jim. I appreciate it.